Hi, my name is Ann Matino, and I am a clinical director for Texas for Charlie Health. Charlie Health is an all virtual IOP for adolescents and young adults, and we are aiming to be nationwide, saving lives because of the high rate of suicide in the nation. We work with mental health and substance use, and my presentation today is focused on actually both. This is a substance use conference, I realize, and I also know that the basis for a lot of substance use is mental health. It used to be years and years ago in many cities there would be a building in a town that helped with mental health and another building that helped with substance use. Well, thank goodness that doesn't happen anymore because they really do need to be talked about together. So life has gotten very complicated for all of us, and you are here because you have a hope that there will be solutions, and there are solutions. I'm going to talk about some hard things to hear, and also we'll be giving you ideas of how you can help struggling youth in small and medium and big ways. We're going to talk about a number of different kinds of interventions and also some evidence-based treatment. Today, we're going to talk about the foundation and the solution. I'll talk a minute about what that means. The changes in diagnoses in substance use disorders, levels of care, some interventions, as I mentioned, a little bit about adolescent and young adult brains, and then some information about those that are most at risk and some tools that you can use to help proactively, including digital hygiene. And then some things that you can do in your organizations and in your life to help with this crisis in substance use and mental health for kids. I do have quite a few resources at the end of my presentation, which will be available to you as well. So foundation and solution. So often I look at kids and young adults, any clients that I work with, in terms of what is their foundation and how stable their foundation is. If they have a shaky, traumatic foundation for mental health, we keep putting more things on top of a shaky foundation. And that's dangerous for many reasons. And it leads to a lot of mental health issues and not very healthy lifestyles for people as they grow older. So a lot of what I will be talking about is prevention that can happen that will help kids be more healthy and avoid substance use issues in the future to build a stronger foundation. Also, in terms of a solution, when we say solution, we often think that it's a good thing. Substance use actually is a solution. It's a solution for mental health issues, and it makes perfect sense that if kids are in pain that's not otherwise addressed, that it could lead to use of substances. So it is actually considered a solution. And what we're looking for is to strengthen our ability to handle issues and seek help before kids are looking into using and abusing substances and what other solutions are available. Substance use, I'm not going to use a ton of statistics. That might surprise you, but this is what we know. We know we have an epidemic on our hands with substance use and mental health issues for all Americans, but we're just going to really focus on adolescents and young adults today. Statistics are helpful because they help us understand the enormity of the problem. And if we track statistics and they go down, we know that something is causing that. And if we can find out that the interventions that we're using are helping statistics decline, then that's important. But what we know is that substance use is the #1 killer of people under 50, and that 40% of youth smoke marijuana. Now, that's not a change in the last 5 years. The difference is that kids are smoking more frequently, and it's stronger. But whatever the statistics show here, they're too high. By the end of high school, 70% of youth have tried alcohol, 50% have tried illegal drugs, and 20% have tried prescription drugs off-label. I wanted to talk a little bit about the changes that we've seen with the DSM-5 in diagnoses regarding substance use disorders. First of all, SUD, substance use disorders, that was not in previous DSM manuals. We use substance abuse and dependence and addiction, but not substance use disorders until the DSM-5 came out. So what folks did was collect a lot of really good information about substance use and created a different way of looking at diagnosing, similar to the way DSM-5 diagnoses autism spectrum disorder. It used to be we looked at autism spectrum disorder differently. We looked at Asperger's, but we didn't look at it in terms of being a spectrum. Now, autism spectrum as well as SUD is looked at from mild symptoms to medium symptoms to severe symptoms. I've listed the types of substance use disorders. What is different about the DSM now is we're looking at 11 symptom areas that fall into 4 different clusters below: impaired control, social impairment, risky use, and physical dependence. There are actually 11 symptoms that fall into these 4 clusters. And if folks experience 2 to 3 of these symptoms, it's considered mild substance use disorder. If they experience 4 to 5 symptoms, it's moderate, and over 6 symptoms is considered addiction. So this is a difference, and it's much easier to tell where in the spectrum of SUD folks fall, which indicates what kinds of treatment makes the most sense for them. In terms of the 11 different types or different symptoms that fall into these 4 clusters, I'm just going to list a couple of them. Substance use is often taken in larger amounts or over a longer period than the patient intended. Persistent attempts or one or more unsuccessful efforts are made to cut down or control substance use. A great deal of time is spent in activities necessary to obtain the substance, use the substance, or recover from its effects. Craving or strong desires or urge to use the substance. Recurring substance use resulting in a failure to fulfill major role obligations at work, school, or home. Those are just 5 of the 11 symptoms that fall under these symptom clusters. We can really look at these symptoms very specifically and say, is this young person experiencing this, yes or no? So it's much easier to look at whether folks need or experiencing mild, medium, or severe types of substance use. Next, I wanted to talk a little bit about levels of care. Sometimes I hear people talk about the fact that people have failed in a level of care, and I would never ever say that. What we want to do is find the right level of care for what someone needs. So the levels of care are used by insurance companies and by treatment programs, and these are the primary levels of care that we'll find for substance use treatment and also for mental health treatment as well. Outpatient therapy, obviously once or twice a week, it could be 45 or 50 minutes. When people who have substance use issues start with an outpatient therapy, if that's working, then that's great. The greatest indicator in the success of a relationship with outpatient therapy is the relationship between the therapist and the client. Of course, they also need to know how to use or to treat substance use disorder. If that's not working, if it's not holding people, if they're still lacking in their functioning, then we need to look at a different level of care. In the previous slide, we looked at the criteria and symptoms. What those symptoms were really reflecting is, how is this person functioning in their life? How is their functioning being impaired in school, in work, with relationships, in their health? So that's really what we're concentrating on here. And if outpatient therapy isn't working, then we often look at intensive outpatient programming. Intensive outpatient programming is 9 hours of group a week, and individual therapy and family therapy. At Charlie Health, we also have quite an extensive offering of family programming and support other than that 9 hours plus the 2 hours of individual and family. When clients come to Charlie Health or other IOP programs, oftentimes they are on the verge of needing hospitalization or residential treatment. What our hope is that we can hold them and treat them in that level of care so they don't have to go to a higher level of care. But if they do, and that's the right thing, we will find the right next thing for them. Sometimes it is hospitalization, which is inpatient treatment. Other times it could be residential treatment, where they're spending 30 more days or more days in a facility and getting concentrated treatment. After they go into the hospital or residential treatment, often IOP is the right level of care to discharge them to. There is another level of care called PHP, which is partial hospitalization programs, and some facilities do offer this as a step down to inpatient hospitalization. And that level of care is all day long, but going home at night. Obviously, folks with severe substance use issues may need detox. This doesn't happen often for adolescents and young people. If they are involved with heroin use, severe drug use, of course, detox may be necessary. The older kids get, the more they may need detox, but usually they can work through their issues and get treatment without detox. Some facilities that offer residential treatment do also have detox. Some hospitals do have detox as well. Wilderness is a level of care that hasn't, for many years, hasn't been included in a list of level of care. Prior to my coming to Charlie Health, I did work at an organization where it was a year-long program for adolescents and young adults. And oftentimes we would get kids out of wilderness into that program for continued treatment, for family treatment. And sometimes we would actually recommend that they go to wilderness. Wilderness is one of these levels of care that if like any of these levels of care, if you find the right treatment program, it can be very, very helpful for kids and adolescents. Experiential therapy is evidence-based. Being outside is evidence-based. And there's some really good programs throughout the United States in wilderness as well. I also wanted to mention sober living because the greatest, although we talked about the greatest indicator of success in a relationship is a therapist with experiencing therapy, 90 days plus is really evidence-based in terms of looking at somebody who has a severe addiction or severe substance use disorder. Even though insurance companies may pay for 30 days, usually don't pay for longer than that. Evidence-based is 90 days plus, which might mean residential. And then kids might go into, say, a sober living and have IOP level of care for a year. That would actually be ideal. The right level of care, again, it's not good or bad, and you can float between these levels depending on what you might need. So talk a little bit about interventions. I did want to put here structured interventions, the type where you hire someone to help you get a loved one of yours into treatment. This can be extremely important for families who are beside themselves with kids or young adults that they have in their families and they are not willing to get help. Interventionists are trained in many different ways. It's important to find an interventionist and understand what their training has been, that they are going to be set boundaries and help you and your family and also treat your loved one and you with loving kindness. So structured interventions, I just wanted to mention that. We talked about 90 days plus for length of stay in terms of going between levels of care. And we also talked about some step down options. I wanted to mention 12-step programs and other community programs are available. And many people do get sober by attending 12-step programs, not going into other types of treatment that I just spoke about. That's fine too, whatever works. So what we know is important that there is family support and that also folks, when they become sober, are working a program. Working a program can mean many different things, but it means being in community with people that are sober. It means remembering some of the things that you learned either through 12-step programs or other community programs or in your treatment, the treatment program that you went through. Many have alumni organizations as well. Also, in terms of maintaining sobriety, looking at mental health issues, just because someone's not drinking doesn't mean they're not still experiencing depression or anxiety. And we need to make sure that the interventions ongoing include some support for mental health. Over a year ago, a young person that I was working with was an adolescent who was cutting. She didn't have substance use issues, but she talked about an app called I Am Sober. And this app is something that I've recommended to people ongoing. It keeps track of how long, or it kept track for her of how long she went without cutting. It also provided her with some support for other people who'd been through similar situations and really encouraged her and helped with her self-esteem and confidence. So that is something that I recommend to folks who are going through a number of different issues, and especially young people, because it is on technology. We'll talk about the downside of technology, but that's also something that they can relate to very easily, are apps that address their issues. Other applications for accountability are available too. They keep track of how long people have been sober from substances. They can tell you where close meetings are by you in your community and many other things. So there are other applications that are available that are helpful as interventions. I wanted to mention a little bit about psychotropic medications as well. Psychotropic medications for mental health, when they're indicated, are wonderful. I also say to people when I talk about medications that it doesn't have to be the rest of your life, and it doesn't mean that you're failing at anything. Psychotropic medications, like I said, can be extremely effective for depression, anxiety, and other mental health issues. And it's important that people have a good assessment about what's going on with them to see if these medications might be indicated. Again, I stress to folks that it's not that people are weak if they have to take a medication or try medication for a mental health issue. It's just like diabetes, heart problems. I often use heart problems, and I say, if you found out you had a heart problem and someone told you to take medication, would you say, no, I'm just going to do this by myself? So oftentimes making that connection between a physical issue and a mental health issue can help people understand that this can be a momentarily help. What medications can also do is help people get feel a little bit better so that they can take in the treatment that's being provided to them. If somebody is extremely depressed and they come to me and I say, listen, I've got some dialectical behavior therapy skills that I'm going to teach you, they're too depressed for that. Sometimes they need to have some relief or experiencing some relief to be able to take in and understand the tools and different things that they can use to help continue in their mental health journey. Mentioning a little bit about medically assisted therapy. Pharmacotherapy is treating a drug of dependence with a prescribed drug. So for years, MAT, medically assisted therapy, or treatment was very, very controversial. There was a large group of people that said, we don't want to be on drugs at all, or medication at all. So MAT isn't for me and it doesn't work, and that's not okay to substitute a medication for another medication. Well, what I will tell you is MAT is evidence-based at this point. And so a lot of treatment programs are using MAT specifically for opioid dependence. It's saving people's lives. And yes, if you are on Suboxone, people have feelings about how long someone is on Suboxone, the fact that when you get off of Suboxone, you do go through withdrawal symptoms. So it's still somewhat controversial, but it is evidence-based. Baclofen, Antabuse, and naltrexone are pharmacological interventions for alcohol withdrawal, and they can be very helpful. So I want to talk a little bit about harm reduction versus abstinence. So at Charlie Health, we actually have a decision tree when kids come in and young adults come in to figure out which are the IOP groups where they're going to find kids that represent what they have gone through. It's really amazing. It is primarily mental health, but we do have substance use tracks. Some kids or young adults we may put in a harm reduction track for substance use, and others an abstinence track, depending on what's going on with them. Harm reduction, an example of that, of course, would be you're seeing an adolescent and they're overusing substances. We're not really sure what's going on with that yet. It's causing them some functional problems in school with their relationships, etc., and they're drinking and driving. So I might say to that individual, hey, listen, what do you say we figure out a plan so that you're not going to drink and drive? That would be harm reduction. With adolescents, if you tell kids all or nothing, they're going to pick all. So we want to make sure to look at to listen to them, not judging them, figuring out what's going on with them, and then seeing if we can reduce harm, while some kids and young adults may need abstinence-based treatment, and that may be their goal. So for years, confrontation became kind of a treatment of choice or a behavior that was seen as helping addicts. And I know that this is a lot of words here, but I thought that this was really important because this is now evidence-based. So this is an abstract that talks about how confrontation has never been evidence-based in treating folks that have substance use disorders. So the use of confrontational strategies in individual, group, and family substance abuse counseling emerged through a confluence of cultural factors in U.S. history, predating the development of methods for reliably evaluating the effects of such treatment. So basically originally these practices were practiced within peer-based communities like AA and other communities, but not in professional communities. And then that confrontation-based style was actually extended to authority-based professional relationships. And when that happened, there was evidence of abuse and harm in the therapeutic relationship because of that way of working with addiction. So for decades of research, 4 decades, of research have failed to yield a single clinical trial showing the efficacy of confrontational counseling, whereas a number have documented harmful effects, particularly for more vulnerable populations. So there are a number of evidence-based alternatives to this type of counseling, and clinical studies show that more effective substance abuse counselors are those who practice with an empathic, supportive style. It's time to accept that the harsh confrontational practices of the past are generally ineffective, potentially harmful, and professionally inappropriate. When we had a educational opportunity at Charlie Health to talk to our staff about some of these changes in substance use disorder treatment, one of our own therapists said, if it wasn't for confrontation, I wouldn't be sober right now. So I know that there's ways that setting boundaries and confronting have saved people's lives. And this is evidence-based that an empathic supportive style is the best. More evidence-based interventions. So motivational interviewing, you may have heard of this. A lot of research went in to discovering and developing styles of treatment that include addressing motivation and behavior change. And this is evidence-based. So the spirit of motivational interviewing is the foundation of the counseling skills required for enhancing clients' motivation to change. Ambivalence about change is normal. Resolving clients' ambivalence about substance use is a key focus of motivational interviewing. Resistance to change is an expression of ambivalence about change, not a client trait or characteristic. So that's important to realize that also in the past, we have looked at, and AA still says there are character flaws. It's problems with your personality or character traits that are causing or contributing to your substance use and your addiction. Motivational interviewing is not saying that. It's saying ambivalence about change is normal, and that's what we've got to work with. Reflective listening is fundamental to the 4 motivational interviewing processes, which is engaging, focusing, evoking, and planning. And really, the counselor's main focus in motivational interviewing is to elicit the client's reasons for and commitment to changing substance use behaviors. In addition to motivational interviewing, cognitive behavioral therapy is, in the face of change, is currently the best gold standard for SUD treatment. So motivational interviewing and cognitive behavioral therapy, which is changing the way you think, changing the way you behave. So a little bit about adolescent brains. Early exposure, a critical factor of substance use disorder later in life is early exposure. So adolescents that used alcohol by 14 have 7 times more of a chance of having an alcohol problem than if they waited until after they were 21. The majority of folks who have substance use disorders started using before 18. What we know, it's always been true with adolescents, is they're developing their identities and what's important to them. What happens when they are beginning to use drugs is that using drugs and alcohol feels more normal to them. And what eventually can happen is what they're seeking, which is relief from depression and anxiety, is actually what's caused by using substances. So that's what I mean by addictive drugs and opposite feeling states. There is a YouTube video here in the presentation that you can watch at another time, but I'm not going to put this on right now. It's a little bit more about youth and their brains, and what's happening is in the resources. And so you can look at that later, and that's a little bit more about youth and their brains. So stepping across the line into kind of who is more or most at risk for substance use disorders. So we talked about early exposure already. Also, 50% of risk is genetic. So people have talked about, my grandfather, my father, et cetera. So it's important to find out what kind of history of substance use there is in families. So I will fully self-disclose something right now because I think it's important in certain areas to say that I have 2 adult daughters, 26 and 27. They are both in recovery from alcoholism. My ex-husband is an alcoholic and his father was an alcoholic. They are, my ex-husband and my 2 daughters are in recovery right now. My daughter's one 7 years, the other 4 years. They both went to 1 year of treatment and various levels of care. That's my story. That's not everyone's story. But just in light of, a real life example of how risk is genetic. Also, most at risk, kids who are really abusing social media and technology. And I have a section on that later we'll get to. Sleep is so important, more important than a lot of people realize. Columbia University says adults need 7 to 9 hours of sleep, teens need 8 to 10. Sleep problems can contribute to the onset and worsening of different mental health problems, including depression, anxiety, and suicidal ideation. If you already have mental health issues and you are not sleeping well, then this really exacerbates psychiatric symptoms, which can, of course, lead to substance use or suicidal gestures. So looking at sleep and sleep hygiene is extremely important. ACEs is the Adverse Childhood Experiences Questionnaire. ACEs scores, and if you're not familiar with this, they look at the risk of disease and social and emotional problems in adults based on what happened when they were kids. It measures the amount of toxic stress that you endured as a kid, and it alerts you to health issues in your future. So I do have these here, but I'm not going to go over all of them, but I am going to read a few of them. Did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? Did you live with anyone who's a problem drinker or alcoholic or who used street drugs? Do you often or very often feel that you didn't have enough to eat, had to wear dirty clothing, or had no one to protect you, or your parents were too drunk or high to take care of you, or take you to the doctor if you needed it? So I'm not going to go through all these because, as I said, they're here, but this is an amazing tool to look at the risk factors in someone's future based on the trauma when they were younger. So if you have an ACE score of 0, there are 10 questions on the ACE questionnaire. If you have an ACE score of 0, the likelihood of becoming an alcoholic is 2.5%. If you have an ACE score of 4, this is out of 10, it increases fourfold to 11%. If you're suffering for chronic depression as a woman, 15% of women with an ACE score of 0 suffer from chronic depression, and it jumps to 42%, which is tripled with an ACE score of 4. It's an excellent tool to use to look at what risk factors all of us have. In addition, an ACE score of 4 or more, pulmonary lung disease increases 390%, hepatitis 390%, depression increases 460%, and attempted suicides increased 1,220% with an ACE score of 4 or more. So Gen Z, in December 7th, 2021, the US Surgeon General declared an official youth mental health crisis. This is because the Surgeon General did an amazing job of collecting data and looking at exactly what's going on in our country. It is an unbelievable report. In the 12-month period from 2019 to 2020, this is pre-COVID, Gen Z was 2 to 3 times more likely than any other generation to report thinking about, planning, or attempting suicide. Also, they were 2 times more likely not to seek help. 63% of US counties have a facility to provide mental health outpatient treatment for youth. So that is a little bit old data. I'm not sure if that's exactly up to date. I think that was 2019. So getting back to millennials and Gen Z, they're stressed out, depressed, anxious, the most anxious generation recorded in history. They have the least positive outlook on life. This is in terms of when this kind of data was being collected, including lower levels of emotional and social well-being. Some people have called this generation the hopeless generation. And I want to let you know, it's not that they are hopeless, we're hopeless for them, it's that they have lost hope. A number of them have lost hope, not knowing what to look forward to and not knowing how to get through. And this is just really important to realize. Kids feel stuck, young adults feel stuck, and a lot of us feel stuck too. What can we do to support them knowing that there's something on the other side, getting through? So we have this culture of happiness. The world is saying that you need to look at social media and you need to be like so-and-so, and you should be happy. And if you're not, something is wrong with you. Well, that's not the case. Happiness shouldn't be the goal. And this is something that we can model in treatment and in our own lives for kids, is that bad things are going to happen and you need to figure out some ways to work through them. And we as adults need to model that for them. And it's hard for us as well. So hardships are really unavoidable. Endurance and resilience are really important to look at in terms of goals to avoid. It's not to avoid hardship. The goal is to get through. And I had two examples of that. Actually, I was listening this morning, in fact, to the Duke University basketball coach give a speech to her basketball team. And she was wholeheartedly saying, we are waiting for things to get easier. After this season, after your junior year, after whatever, things will get easier. Well, they won't. What we need to do is we need to learn how to handle harder well. And I love that. I just saw it again this morning, and I just thought I'd mention that. The other thing about endurance and resilience that we can talk to our kids about is have them listen to people who struggle that they appreciate or they see on social media. Healthy people or celebrities that they know that are open and honest about their struggles with substance abuse, their struggles with mental health, and that they got help. That's super important for our kids to know, because there is hope. So I debated about whether to put this in this presentation. It's about hope and suffering. But I wanted to mention, when I was the executive director for a 90-day women's program, these women went to multiple treatment programs before they got to us. They were challenged with mental health issues, with substance use issues, and a lot of trauma. And we used to tell them, we will hold help for you until you can hold it yourself. And I think that's something that's really important to talk to kids about. They need community and connection and professional help. So I have three quotes here that I thought were kind of interesting. Not to say, look, you just need to buck it up. That's not at all what I'm saying. You need treatment. And there are people out there that that have let us know that good attitudes and understanding that there's something on the other side is really important to know. So the ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenge and controversy. So challenge and controversy are okay. You've heard it's okay not to be okay. Desmond Tutu, suffering is part and parcel of the human condition, but suffering can embitter or enable us. It can enable us and become a spirituality of transformation when we find meaning in it. And Viktor Frankl, who was in several concentration camps, actually wrote a book called Man's Search for Meaning. Everything can be taken from a man, but one thing, the last of human freedoms. To choose one's attitude in any given set of circumstances is to choose one's own way. And this is important because this can lead us to talking about a lot of things. One is cognitive behavioral therapy. Again, how you think, changing how you think, change how you feel. It can lead to discussions about meditation, being present, mindfulness, and the importance of attitude. Just a little bit about the prevalence of depression and anxiety symptoms during COVID. Until I started doing research on this particularly, I didn't know that this had been done, and there'll be many studies done about COVID for many years to come. But there was a meta-analysis of 29 studies of many, many youth, over 80,000 youth globally, that showed the incidence of elevated depression and anxiety symptoms based on COVID. And I just wanted to put this in here because a lot of the data and a lot of the other studies that are national really ends at 2020 so far. And so there's not a lot out there on COVID, but the results collected later in the pandemic charted higher depression and anxiety symptoms, particularly for girls, and depression symptoms were higher in older kids. We'll find out more about that, but I just thought that was important. The Youth Risk Behavior Surveillance System collects a lot of information in 6 categories of health-related behaviors for kids. And, I thought about putting a lot of these statistics in about Idaho versus the United States and this and that. And I just decided again that we know it's high. So what are we going to do about it? So I didn't really look at all of that, but that is referenced in at the end in resources. So if you want to look at some of those studies again, the last collected data was in 2019. And there also was another kind of study called Healthy People, and it talks about 11 objectives to adolescent health, and most of them are not measured in the YRBSS. I'm just going to mention a couple of these because, again, these are things that we can look at when we're looking at preventing substance overuse, abuse, and mental health concerns with kids. Adolescents wellness checkup, not only adolescents, but all of us. So when you're experiencing symptoms or you're noticing your clients or your families experiencing symptoms, don't discount that it could be something medical. Sometimes we jump into depression, jump into anxiety. There could be something wrong with our bodies that's medically indicated to get help with. So it's really important that we make sure that our kids are getting wellness checkups. After school activities. So I had a Girl Scout, actually, a 16-year-old Girl Scout called Charlie Health, and it was directed to me the other day. She was doing a study on mental health. And she asked me, tell me about what you think about athletes and mental health. And I told her, anything in excess can be dangerous. So after school activities, participating in sports, being in community with peers, amazing, great stuff. And anything overdone can be dangerous. Are you working out so hard that you're losing so much weight? You're worried about your body image. You're so concerned with competition that you can't function in your life. You're so concerned with helping yourself or pleasing your family that you're getting over anxious. So after school activities, great. Just look at anything in excess. Adolescent adult connection. We've talked about connection and engagement. Charlie Health was started because the lack of connection and lack of engagement are killing kids, and it's not okay. And they need to be connected with kids, peers their own age, and also with adults. I'm not going to talk about foster care really right now, but there's some other things on there that you can see that lead to healthy adolescent health. So I just wanted to kind of mention that study as well. And also, I did want to mention that if you all are working in the behavioral health field, you are all protective factors. And that's something that I love to talk about, protective factors and resilience. So if you've seen a kid just for a brief period of time and you see them and you hear them and you are helping them, and then they come out of your life because they go out of your system or whatever, you are still a protective factor. They know that that can happen, and so that they know in their minds that it can happen, in their hearts, it can happen again somewhere in their life. So thank you for being protective factors for our kids. A little bit about digital hygiene. Okay, so we're addicted. We know that. Addictus in Latin means slave. I just learned that too. So the average smartphone user, according to Apple, spends 3 hours a day on their phone and unlocks it 150 times a day. Over 80 people say they couldn't go all day long without looking at their phones. Average social media use over lifetime is now listed as 5 years. So self-centric despair is a little bit related to what we talked about before, about our lives don't look like anyone else's. So we're driven by comparison on social media, and comparison can lead to contempt, and one of the downsides of technology for sure. Deformational trajectory is actually the concept that because of technology, we have to do less, way less. So because technology provides us with unending education and unending stimulation and unending distraction, it decreases the amount of skill and strength and participation that we need to have in life. That's what that means. Distraction is something that's preventing all of us from being able to be still, alone, and quiet. This may sound like the opposite of or the same thing as isolation, but that's not what I'm talking about. Being okay with being okay with breathing, being okay with not having to look at media all the time. So technology has created all sorts of amazing ways that we can spend every minute watching something new. And it's mindless entertainment. And that's really affecting our kids, as you know. The buzzing sound of somebody on social media or somebody that needs to send you a message. So just something I wanted to mention in terms of contributing directly to mental health issues. The greater time on technology, again, evidence-based now, more likely individuals will experience worse sleep, shorter attention spans, sedentary and isolated experiences, lack of imagination and creativity, atrophied social skills, decrease in the sense of privacy, and increase in depression, anxiety, and stress-related health complications. So what can we do about all of this that we haven't talked about already? We've talked about some, like I said, small, medium, and big things that we can do. Don't beat around the bush talking with your kids, neighbors' kids, friends, your clients about asking them exactly what's going on with them. Are they thinking about killing themselves? Really important that we're not just saying hurting yourself, but we're saying killing yourself. Years and years ago when Columbine happened, I met with a man who was an expert in this type of tragedy before it was happening so frequently. He said, tell kids or tell friends of yours who might be thinking about suicide, I would be devastated if you killed yourself. I can't tell you how many times I've said this to other people in my life because, and in my professional and personal life, because if kids are getting to the point, whether they're using substances or not, that they're thinking about taking their life, they can often convince themselves that that's the best thing for the people around them as well. Get the facts. Try to be curious without judgment when you're talking to kids about how they're feeling and seeing and hearing them. They can feel invisible, which leads to isolation, and it can lead to substance use and mental health issues as well. Look into the role of spirituality and a higher power. Ask kids what they believe in and what will help them, what helps maintain their sanity. That's important too. And then medication and meditation. So we talked a little bit about medication before. Is that something that's indicated? I would love to spend a lot more time talking about meditation, but I will tell you that there's an app. It's a free app called Insight Timer. There's another app called Calm. There are hundreds, thousands even. So Insight Timer and Calm are just two free apps that provide a lot of assistance with meditation, guided imagery, music, and kids can set, or young adults, anybody can set a timer for 1 minute or 5 minutes or 10 minutes of being calm. So these are opportunities to assist anybody with meditation. It's really hard to do, to stay with your own thoughts and to calm down. What we know is this is working. Yoga, which is also now evidence-based, and meditation are being taught to kids in primary schools, in preschools, in elementary school, and it's really helping them be able to regulate themselves. And this is something that, again, preventatively that we can do and is really important. If you're part of an organization, create space for discussion about new things that you found that are helpful to people to calm themselves, to regulate themselves. People have all sorts of ideas. So some things work for some people, others work for others. So it's really important to have an agenda item, maybe in one of your meetings, where you talk about what has worked for you and what have you found works for kids that you're working with to help with emotion regulation. Digital discipline, slowing down, cultivating patience is something that is going to be hard to work on ongoing. But again, if families are exhibiting this and if they're setting some goals around digital discipline, that's going to be really helpful. Know your levels of care and the resources available in and outside of your community. This conference and the folks that are running it have a lot of information on this for you. Help people understand how their behavioral health benefits work. What can they access? What can't they? How can you help them stand up for themselves and advocate for themselves and what they need? Parents need to get help themselves. They can look at their kids. They can feel shameful that they didn't do a great job parenting. Come alongside them. No judgment. What can we do for you? How can we help you? Parents need to be stronger in their family units to support their kids and their young adults. I understand, easier said than done, but something I definitely wanted to put in here. Stressing hope. We talked about celebrities, public figure testimonials, anybody who you can talk to that has a story that they're willing to share. My kids always say, I can share their stories. And it always leads to other people saying, well, this is happening in my family. Utilization of mindfulness and coping skills. There are so many different kinds of breathing and grounding techniques. Tapping or EFT, emotional freedom technique, is something that you can do, you can look into and do yourself. Very easy one would be, this is a little bit different than EFT, but it's called a butterfly hug, where you just cross your arms, again, going across your center line. There is something that your brain says is good about that. Tapping and just calming yourself down, very easily done. So there's a lot of tools out there. Use of outside is evidence-based, moving your body is evidence-based, eating healthy, all these things are part of a plan that we can implement to help kids either when they have suffered or when they could be in the future. Just a little bit more about Charlie Health. Our mission is to dramatically reduce the incidence of suicide by providing adolescents and young adults anywhere access to the intensive outpatient program level of care. Because we are completely virtual, we can curate kids into groups with kids like them. We have a lot of LGBTQIA plus kids, 60 to 70% of our kids identify somewhere in this area. We've got survivors of bullying, we've got female trauma groups. So instead of just putting kids in groups that are just all having mental health issues of some sort, we can curate them so that they can be in groups with kids with similar experiences. We also, and I actually run a survivors of suicide support group, and we have other community groups that are available for kids for free. We also do have a once a month LGBTQIA plus 101 class for parents. You do not have to be a part of Charlie Health. If you want to learn more about pronouns and more about what's going on in this area, we educate our staff very frequently in this area as well. So in closing, here is our number if you need it, but more importantly, you're welcome to reach out to me if you want to discuss anything that we have talked about here, and I'll be live for questions after this runs during your conference. So thank you so much for listening to me today. I hope that some of this has been helpful for you, and thanks for all you do for your community. And there you go.